On the morning of December 4th, 2024, UnitedHealth CEO Brian Thompson was fatally shot outside a hotel in Midtown Manhattan. It was a targeted, premeditated attack. Normally, the murder of a high-profile corporate executive prompts universal grief, along with public thoughts and prayers. Net responded with over 77,000 laughing emojis. Patients and medical professionals flooded platforms like TikTok and X. Emergency room nurses and families of sick children openly stated they felt absolutely no sympathy for the victim, citing their own brutal experiences navigating his company's policies. This raises a deeply unsettling question. Why did a tragic assassination bypass normal human empathy and instantly trigger mass celebratory rage directed at the American healthcare industry? To understand the anger, you have to look at the sheer scale of UnitedHealth Group. This is a corporation that pulls in over $400 billion in annual revenue, making it larger and more lucrative than tech giants like Apple. They achieved this mass through intense vertical integration. The parent monolith sits at the top, branching down to own the insurance provider, pharmacy manager, and medical clinics. This creates a closed financial loop. The corporation restricting insurance payouts also employs the doctors prescribing care. UnitedHealth Group functions essentially as a self-contained healthcare economy. They dictate the cost, control the access, and hold immense, unchecked power over the medical decisions of millions of patients. The United States spends almost double per capita on healthcare compared to other wealthy nations. Yet, despite that spending, the U.S. ranks an abysmal 42nd in global life expectancy. This discrepancy comes down to the core economic model of for-profit health insurance. To maximize returns for shareholders, these publicly traded companies must aggressively limit the amount of money they pay out in medical claims. This chart shows how often that happens in practice. In 2023, the average claim denial rate for in-network Affordable Care Act plans hit 19%. It replaced human medical judgment and basic empathy with rigid, cost-saving algorithms designed to protect the bottom line. When we return to the crime scene in Manhattan, the calculated nature of Luigi Mangione's attack starts to take on a highly specific context. Investigators recovered spent bullet casings from the sidewalk. Etched into the metal were 3 distinct words: deny, defend, and depose. These words directly mirror delay, deny, defend, a well-documented operational strategy used within the insurance industry. The tactic relies on drawing out the appeals process until sick patients are simply too exhausted or bankrupt to continue fighting for their coverage. When this physical evidence was made public, it acted as a massive online catalyst. The message instantly polarized the internet, offering a twisted sense of validation to people who had fought those exact administrative battles. Because the bureaucratic maze of internal appeals is so complex that less than 1% of patients even attempt to navigate it, segments of the public began projecting their frustrations onto the shooter. They viewed him as a vigilante taking aim at an untouchable system. While the assassination was a brutal, cold-blooded crime, the killer's message successfully weaponized the collective trauma of millions of Americans who felt entirely abandoned and exploited by the insurance machine. Economist William Lazonick points out a structural reality. Insurers could maintain profitability by providing high-quality, accessible care. Instead, they actively choose a business model built on aggressive claim denials to artificially inflate their shareholder dividends. The financial outcomes of this choice are incredibly stark. While CEO Brian Thompson received a $10.2 million annual compensation package, everyday citizens who pay into his system face crippling medical debt. This chart illustrates the extreme wealth disparity inside that economy. Half of all U.S. adults report that an unexpected medical expense of just $500 would push them into financial ruin or bankruptcy. Consumers are trapped. They are legally mandated to pay thousands of dollars in monthly premiums, only to be hit with high deductibles, out-of-network surprise billing, and restrictive care networks when they actually get sick. The public celebration of a CEO's murder serves as a terrifying warning sign of a failing system. It points to the complete disintegration of the social contract, a breaking point reached when a single corporate monopoly holds the power of life and death, and citizens believe that all lawful